and we know that the biggest weapon we have is vaccination. So whatever comes up on the news that addresses that, I think we'll all jump on it because we all want this to be over.
Right. Well, I don't want to get ahead of ourselves, but as a nosy journalist, there's so many questions I could start asking. This is always our downtime. We just kind of chit chat a bit and break the ice. I know a lot of conference calls just are dead silent until the hour the curtain rises, but we are welcoming so many of our media and we're also welcoming our speakers. It feels like a moment to just connect and communicate personally. So I just want to thank all the media for joining. We will start, as you know, in pretty promptly at the hour of 2 o'clock, which is in about 2 minutes. And I want to thank our co-hosts, Vaccinate All 58, the Vaccinate All 58 campaign.
Recording in progress.
Part of the California Department of Public Health. So I will go off for about 60 seconds and then rejoin. I always check the text to make sure nobody's been locked out.
Recording stopped.
Thank you all for being on time.
Recording in progress.
Welcome, everyone, and thank you for joining today our special briefing co-hosted by Ethnic Media Services and the Vaccinate All 58 campaign. I'm Sandy Close, Director of EMS. Today's roundtable discussion will focus on children amid the COVID-19 pandemic. We are honored to have Dr. Manisha Newaskar, Pediatric Pulmonologist at Stanford Children's Health, Dr. Jose Luis Perez, Chief Medical Officer at South Central Family Health Center, and a familiar and valued voice on our briefings. His colleague, David Center, David Roman, I'm so sorry, David, Director of Development and Communications at the South Central Family Health Center, and Dr. Priya Soni, Pediatric Infectious Diseases Specialist at Cedars-Sinai Medical Center. All of our speakers are experts in their fields and can provide their insights on recent news related to COVID-19. We want to emphasize that our speakers are not employees or representatives of the state of California. If reporters on this call seek that perspective, please contact CDPH Press at cdph.org Today's briefing will be interpreted in 3 languages, Spanish, Korean, and Mandarin. We ask our panelists to please speak slowly to give our interpreters the appropriate amount of time to translate. Reporters, we welcome your questions as always in the chat box. We are live streaming today's conference, and we will send a video to all participants this afternoon, along with extended bios of our speakers and highlights of the briefing. Now I'd like to turn it over to veteran journalist and EMS contributing editor, Sunita Sarabji, to moderate our discussion. Sunita. Mute.
Thank you so much, Sandy, and welcome to all our speakers and reporters. We hope to have a robust discussion today and to provide you with valuable information to inform your reporting. The last 20 minutes of our briefing today will be reserved for your questions. So with that, let's begin. Question number 1 is for Dr. Priya Soni. Dr. Soni, there has been a spike in COVID-19 cases among children over the past weeks. Currently, over 10 million children have tested positive, representing 5% of all overall hospitalizations and almost 2% of all deaths. To what do you attribute this spike in child cases?
Thank you so much, Sunita. So I'll start by saying that until pretty recently, it seemed like one of the only silver linings of this pandemic was that the children were not really being as affected as much. They were kind of escaping the worst of this. And we know now very clearly that since even Delta variant has been prominent, and now most recently Omicron, that has changed completely. And the reason we're seeing such a spike in not just cases in pediatrics, but also hospitalizations is a multifaceted sort of factors that are at play here. The first, of course, is that Omicron is highly transmissible, much more transmissible than Delta variant was, with a higher replication rate. And what we were finding in studying the Delta variant versus the Omicron is that the household secondary attack rate was almost double that of Delta variant. And so that meant that, if someone in the household was sick, they were more likely to pass it on to not just one, but maybe both children, and vice versa. So it can go both ways now as we understand how this virus transmits as well. And at this time too, when we saw the peak of Omicron happening, that was when we were in the peaks of our winter months. We were spending more time indoors over the holidays. There's more gatherings happening too. So that factor did certainly play a role. And lastly, I think it's important to understand that our whole denominator of positive cases overall was so large in this time period where Omicron really peaked. So we know when that happens that children are going to be affected more as well. So I think it was a whole flurry of different factors that kind of drove that rise in pediatric hospitalizations as well.
Thank you, Dr. Soni. And for reporters, I just wanted to note that the CDC released a report yesterday that showed that children went to hospitals at 4 times higher rate when we were amid the peak of Omicron versus Delta. So I encourage you all to look for that report. It is on the CDC website. We next move to Dr. Newaskar. Dr. Newaskar, in terms of COVID-19 among children, what symptoms should parents be on the lookout for? If a child does have COVID-19, what signs or symptoms should parents look for as indicators to seek additional medical help? And finally, as a pediatric pulmonologist, what are some of the worst cases you have seen?
Thank you, Sunita, for that excellent question. So the symptoms of COVID-19 can vary from mild to severe. and generally begin 2 to 14 days after being exposed to the virus. Some of the common symptoms we see are fever and chills, sore throat, congestion, runny nose, muscle or body aches, a mild cough, even headache and fatigue. And some people will experience loss of taste and or smell as well. And also nausea, vomiting, and diarrhea are some of the symptoms. Symptoms that warrant immediate medical help include dizziness, chest pain, or pressure that just does not go away, shortness of breath or any difficulty breathing, severe abdominal pain, confusion, and trouble staying awake. And if the parents are seeing bluish discoloration of face and lips in the child, then they should be seeking medical attention immediately. Now, we know that most children who get sick with the SARS-CoV-2 virus will have mild symptoms and recover. However, we have seen many children get very, very sick and need hospitalization. In general, children who have underlying medical condition are more likely to get sick, but we have seen even previously healthy children get very, very sick. Multi-system inflammatory syndrome in children is a condition where multiple organs in the body are inflamed, and this is one condition where we have seen children getting hospitalized for. And as far as the worst case of COVID-19 in children, we have seen children with severe pneumonia, respiratory failure, who have ended on ventilatory support and have multi-organ failure. And unfortunately, we have also seen few children die from severe COVID-19.
Oh, that's just tragic. Thank you, Dr. Newaskar. Dr. Perez, what is the impact on families when a child has COVID and when they need to quarantine, or worse yet, need to be hospitalized? And are you seeing parents reluctant to bring their children in until the symptoms are no longer manageable at home?
Yeah, thank you for having me. At South Central, we take care of mostly Latino families, monolingual, Spanish speaking, and most of our parents work in areas where they don't have time off, construction sites, restaurants. So parents will hold off to bring in their children because they don't have the time to bring them on. But fortunately, our experience at South Central has been pretty positive. We have a good 20 to 30 positive cases in children on any given week. And the overwhelming majority have been very mild cases with cough and runny noses. We also have seen abdominal pain and nausea and vomiting in some of our kids, especially the younger one. And so we send the parents home with very what we call the emergency room precautions, and we set them up with a telehealth visit 3 to 4 days later to check on the children. And fortunately, we have not had any death, and we have not up to today haven't had any one of our children hospitalized, which is excellent. But it does put a great burden in our parents because they can't take the time off, and they already are dealing with children having to stay home. And our parents are exhausted, and that's something that we're dealing with on an everyday basis. Our behavioral health department has been really, really busy taking care of both parents and children with an increased risk of anxiety and depression because of the ongoing pandemic.
Absolutely. May I ask a follow-up question, which is, what do you send parents home with when their children are sick with COVID, or when they're showing signs?
Right. Well, the mild and even the moderate cases of COVID are no different than a regular cough and a regular upper respiratory infection. So cough syrups and antipyretics or anti-fever medications are recommended. Lots of hydration is recommended, and close monitoring. The moment that the children have developed shortness of breath, chest pain, or any of the symptoms that would cause to go to the emergency room, then that's when the parents are advised to do it, not to wait for the clinic to reopen, not to wait until the children get in trouble, but immediately just take it. It's just easier and safer to err on the side of caution.
Absolutely. Thank you, Dr. Perez. David, you and your wife send your 13-month-old son, Idris, to daycare. Can you share a little bit about your experience being a new parent navigating this pandemic?
Well, thank you for the question and for having me here. I think, being a new parent, the big challenge is just you've got this new life that is completely dependent on you for everything. And it's, our son is the most precious thing for us in the whole world. So bringing him to daycare every day is an act of faith. It's an act of faith in terms of hope. We're hopeful that other parents have done the responsible thing for them to get vaccinated, that all of the staff has been vaccinated at the daycare, and that the children have been reasonably cared after. Other children have reasonably been cared after, because when they come to the daycare center, we're at the nexus of all of those decisions that have been made. And what we all uniformly share as parents is that our kids are under 5 years old. They can't be vaccinated right now. So, being a parent means a lot of anxiety anyway, because, you have this new responsibility, but it's even more, it feels more so, you feel the pressure of it more as a parent, because you can't get your kids vaccinated. Even if you wanted to, you can't do it. And it feels vulnerable. It feels very scary. And, when you bring your child home at the end of the day, when Idris comes home with us and all he wants to do is hug me or his mom, we all have to think, well, did he contract something today? And then we repeat the same thing the next day.
That must be really difficult to navigate.
Yeah, and I want to acknowledge that, we live in South LA. All the other kids who, go to daycare with him live in the area as well. And yet we're also privileged that we have a place that we can take our son to. A lot of parents, living in South LA don't have that choice, don't have those options. So, you trade in one set of challenges for another. And what we all share in common is, our kids under 5 can't be vaccinated quite yet. And so we're not relieved of that anxiety.
That is a very good point. This is a question for all of you. As the US continues to make strides towards increasing the child vaccination rate, there have been concerns as to why parents are hesitant to vaccinate their children against COVID-19. Currently, just 18% of children who are eligible are actually vaccinated. Dr. Perez, what are you hearing from parents about this? And what would you say to those parents struggling with whether or not to vaccinate their kids against COVID-19?
Yeah, safety, it's a paramount question in parents' minds. Is it safe to give this vaccine to my child? Parents tend to be more protected. The younger the child, the more protected the parent is. And so it is understandable, and we acknowledge that. And you couple that with the poor information out there, especially on social media, things like the COVID vaccine causing infertility, you can see why a parent would be so hesitant. But all parents want grandchildren at one point. And so the greatest weapon that we have is education. Are forums like this where experts like my fellow doctors on the panel can come in and give the right information. And then to the members of the media listening, to spread that information to the respective communities. Education, it is the key. And for the Pfizer vaccine, I am of a two mind. I obviously, the delay in the approval is not concerning to me, because I know that it probably will get approved in the next couple of weeks. But it continues the uncertainty that is out there as far as vaccinating children. On the other hand, it is a great weapon to discuss with parents and tell parents, look, scientists and doctors at all levels of the healthcare system in the United States are taking the utmost precaution in making sure that this vaccine is effective and it is safe for your child. So take a look. If someone's telling you we're rushing, we are not. The fact that we are taking the time to go over the data, go over side effects, and making sure that the vaccine produces the right amount of immunity should go a great length to discuss with parents and anyone who can doubt that the vaccine is effective and safe.
Thank you. Dr. Soni, your response?
Yeah, so I completely agree with Dr. Perez, and I think, as physicians and pediatricians, we are on the front lines of providing accurate information to these parents that are hesitant. And oftentimes we run we try to find line, we want to be persisting in kind of giving them the education, the facts, the real facts around these vaccines, but we also don't want to, come off as too badgering to these parents that are on the line,
Yes.
So it's like it's a challenge for us, and I think most of us understand there's going to be a third of parents that are on board with this right away, some that are just not going to be, and then some in the middle where you can really help them understand and go through their concerns, their valid concerns that they have for their children. And as a specialist in this field, I will have to say that we have to, again, lean into science as we have been through the beginning of all of this. And it's really important for parents to understand that this virus, this vaccine, has been studied more than any other infection or pathogen in the history of time. It has been put under, to say it's been, put under a magnifying glass is an understatement, really. So especially and now that we have such a successful rollout in the 5 through 11-year-old group so far, the CDC has actually reviewed over, has put out a report in the last few months about over 8 million doses in this age group being given with no major safety signals. I think that should be really reassuring to parents in that particular category. And lastly, to these parents on the fence, I think I will also mention that there is no zero risk decision when we're all in this pandemic together. And so you really have to understand that this virus is very, very uncertain. There's no guarantee that even if your child is completely healthy, that they won't have some of the more complications that Dr. Newaskar had mentioned before. So you need to kind of weigh those pros and cons as a parent and speak to your pediatrician. I know they have been, your guiding force for your child for their entire lives, and they know your children more than anyone. So just have those conversations with your pediatrician.
Thank you, Dr. Soni. Dr. Newaskar, what are you hearing from your parents? What are their hesitations around getting their children vaccinated?
Yeah, so thank you, Dr. Perez and Dr. Soni, for your perspective. And I totally agree with them. I think the biggest conversations that I'm having with my patients and my parents that I see are basically concerns about the safety. They want to make sure that these vaccines are not going to cause any short-term or long-term harm to their loved ones. So, these vaccines have been rigorously studied. And as Dr. Soni just reiterated, that they are very safe, and there are millions of children who have been vaccinated. And so we know that the side effects are far less than the risk of having disease itself. So my message to the parent is that if any parent is struggling with the decision on whether to vaccinate their child or not, please discuss your fear and concern with your child's provider. The reason we are in this profession is to keep your children safe and healthy. It's really important to have these discussions.
Dr. Perez, I wanted to bring it back to you for just a minute. You spoke earlier about your parents being, frontline workers and not necessarily having the time to deal with a sick kid. Is some of the concern based on the fact that they don't have the time to vaccinate the child because they don't have the 2 days off to take if their child does in fact come up with side effects?
Yeah, it does. It does make a difference. We have a straight line for kids to be vaccinated, but we still have to go by the CDC rules and questionnaires and checking temperatures. All of that takes time, and it's not necessarily an in and out procedure for our parents. So our parents know that when they bring the child to us, whether it is a sick visit currently or just for a vaccination, is not an hour, 2 hour procedure necessarily. They have to spend a good chunk of time. A lot of our patients, the majority of our patients, live within 1 mile radius of our centers, and most of them use public transportation. So once you start adding public transportation, waiting, getting your stuff done, by the time you get done with it, is half a day is gone. And then most of our parents, if they don't work, they don't make a living, and that puts a strain on their budgets. And so certainly we are very, very aware of that. But as you can see, that's why communities of colors usually are disproportionately affected by these kinds of pandemics.
Thank you. David, how do we address these concerns to assure parents that vaccines are in fact safe and effective and the best tool to keep the families safe?
Well, I think the first thing we need to address is that every panelist that we have here today is a doctor, and you're experts in your field. You're not the problem. The problem is that our parents are listening to other people that they claim are experts. And that is the problem. We have to acknowledge that science to us matters, but culture also matters. And so therefore, maybe utilizing culture in a way to help explain that there are other people in our society, not just scientists who we should be listening to, but other people in this society that also support vaccination. In Los Angeles, I'm Roman Catholic, I'm Latino, and in Los Angeles, about 40% of the population is identified as Roman Catholic. Why are we not sitting out here talking about how the Pope says it's Roman Catholic Pope says it's a moral obligation for people to get vaccinated? Imagine the impact that could have if we lead with that, also with the science, because culture really does matter. We know that from people following celebrities. We know that from people listening to whatever new thing Kim Kardashian said yesterday. They may not be listening to their medical providers. And we just have to acknowledge that it's going to take more voices than just our experts who should be listened to. But unfortunately, at this inflection point in our society, that's not happening.
Absolutely. The next question is also for all of you. While California is home to more than 12% of the nation's public school children, the state represented only 1% of the country's school closures. What variables will continue to play a role in keeping schools open in California? And how do we keep classroom transmission to a minimum? Let's start out with Dr. Soni.
Sure. So, I'd like to start by saying, we're in a very different place now, 2 years into the pandemic than when we were before. And, the measures that have been set in place early on in the pandemic, with knowing how to safely and solidly keep schools open so that children can have little disruption as possible. We know those safety measures are working, and they're continuing to work, even in light of some more transmissible variants like Omicron. And one of these safety measures is ventilation, which I feel doesn't get talked about quite as much. Masking, hand hygiene, we of course know the importance and significance of that, but that paired with the ability to vaccinate our 5 through 11-year-olds now, I think has played a really big role in keeping the numbers in our public schools low. Here in LA County, I will say, we have seen some outbreaks within schools, which outbreaks are reported as 3 or more cases linked to a particular classroom or setting. And, that has made up a very, very small proportion of the over 2,000 schools represented in LA County. So I think that goes to show that the measures are continuing to work. And part of our sort of goals as public health, should be to continue to revisit metrics that would guide us as the pandemic continues to change. And we need to understand that, looking at our hospitalization rates and our vaccination rates in particular areas, that should also help to dictate lifting of restrictions in a more measured way, and not just, we're sick of this and we're just going to get rid of masks now. So I think there's been a lot of talk about, getting those quantifiable measures across the board through that might be more helpful in guiding us as we move on through this.
Thank you, Dr. Soni. Dr. Newaskar, many counties are opening up their restrictions and allowing masks to come off, except for K through 12 schools, but that decision is going to be reviewed, I believe, at the end of this month. Could you address that? How do we safely get our kids back to school without masks?
Sorry, I was on mute.
No worries.
So, I guess what Dr. Soni told us was very important and very pertinent points that we have gotten here through the pandemic by using good mitigation measures, and wearing masks and good ventilation, practicing hand hygiene have been the key factors in keeping our schools safe. And, I think we need to continue the wearing mask in school. Our children need to be safe. And until we have vaccines available and most kids in our country are vaccinated, I think we have to continue these mitigation measures, and I would be strongly recommending that for my patients.
Thank you, Dr. Newaskar. Dr. Perez, would you like to address this question?
Yeah, so I think a dose of reality is really important. When you talk to patients and you give them what is potentially expected, when it actually happens, then they're not so surprised. I think in this particular case, it's important that we keep a dose of reality. The virus spreads through fomites, through saliva, and through mucus, and people contacting each other. If we take away the mask mandate, and as we do it, that there's going to be more people exposed. And the reality is that more people are going to get infected and more people are going to get sick. Fortunately, the majority of folks now are vaccinated, so their disease is going to be mild. We are not trying to attain zero infectivity. That's impossible. So as long as we understand that, yes, the benefit of removing masks from children is important because of the social aspect and the psychological aspect of being in school, has to be balanced with the fact that we are going to have more infections. Now, hopefully, as the vaccine is approved for the younger generation, then we are going to mitigate, to use Dr. Newaskar's word, we're going to mitigate how much infectivity is going to go around. But let's not fool ourselves. As we take out the mask, there will be more people infected. The idea will be that with vaccines and with the current treatments that we have, that we minimize the hospitalizations and the morbidity and the mortality from this virus.
Thank you. David, what are some of the safety measures in place at Idris's daycare, and how do you take extra safety precautions as a parent? You personally, I think.
Well, the first thing is, I've heard all the doctors say today, make sure that our child and we are washing our hands, practicing social distancing when possible, wearing masks, and just sanitizing the areas that Idris is in. But at daycare, we also do a few additional things. We talk to his site director, to the center site director. We talk to the teachers. We talk to other parents, and we come to agreements about how important it is for everybody to be vaccinated. We have that dialogue and we take on that personal responsibility, because you can't mandate anybody to get vaccinated. And these are parents, they're adults, they're going to do what they want to do. But what you can do is you can have that conversation. You can help remind people about a community, that we are a community. And that's the conversation that we have at his daycare, that we are a community of parents and teachers who come together to look after these young kids. And so that's what we do. We have that conversation. And that might be the most important thing that we can do, in addition to all the things that the doctors have recommended, is letting our neighbors, our fellow parents know this matters, that their kids matter.
Before we open the briefing up to reporters, one final question from me. Pfizer and the FDA have postponed their decision regarding the vaccine being available for children under 5. Dr. Perez, Dr. Newaskar, Dr. Soni, when is it realistic to expect that we do have a vaccine for under 5s? Would you like to start, Dr. Soni?
Sure, yes. So I'll start by saying that, I know a huge amount of thought goes into making a decision like this, especially when it was on the agenda, and, it was very confusing for all of us, including us in infectious diseases, and also very disappointing for many of the parents that I've spoken to who are just waiting for this to go through. But again, as Dr. Perez stated, it really shows that good science is in action. And I was glad to see that the FDA made this call. I do feel it's better to get it right and wait to get it right than to rush this vaccine just because, we want this age group to be covered and protected. I will say that the safety data has been good, from what we understand in these age groups from 6 months to 4 years. I think it was a dosing issue in the dose that they used for the clinical trial. And so we will be waiting a few more months. We all have to remain patient through this process and wait until April, until when the company can provide some additional immunogenicity data based on a third dose given. So that's sort of where we're at. And I do think that it's important to sort this out than to rush an approval at this moment.
Thank you. Dr. Newaskar.
Yeah, I think Dr. Soni said it right. So my understanding is that the delay in vaccine is mainly because they are looking at how effective a third dose of the vaccine can be in triggering immune response in these little kids. So we need good, robust data before it can be approved by FDA. And I'm glad they are waiting for that data to come out. And this is another proof of how scientifically rigorous the process of getting vaccines out to our people and our little kids is.
Absolutely. Dr. Perez, final word on this?
Yeah, I see it as a good thing. Look, the 1/3 of the parents that Dr. Soni mentioned, they don't need convincing. They know that the moment that the vaccine comes out, they're going to get it. Then you have that proportion in the middle that needs a little nudging and a little education and a little pushing. And nothing speaks better to that group of parents than saying, like, look, scientists and doctors are taking their time. Fear not, the process is working. We're following the science. We're not going to rush this for no political agendas of any kind. We're letting the science guide what we do for our children. And then the group of people that no matter what you say, you're not going to convince. I mean, there's nothing you can do. Folks have almost a religious affiliation to their belief when it comes to the vaccine, and nothing you can do is going to change them. So I think the process of waiting until good data, validated data, and data that the company and the CDC can support and defend is important for that group of parents that may need a little bit of convincing. And if anything, this pandemic has taught us is that things change and that we all must continue to exhibit patience because we don't know. All signs point to a great summer. All sign points to this pandemic ebbing to the point where we might go out with a mask anywhere. But we were saying that last summer, and then Omicron hit us, and then we were back to square one. So if anything that the virus has shown us is we need to continue to be patient and let science take us whatever it takes us.
Thank you. We start first with a question from Isabel Gutierrez. Isabel, could you start and identify your news outlet, please?
Okay, can you hear me now? I'm on.
Yes, we can.
Hi, I'm with KIQI 1010 AM. The show is called Hecho en California, and we're a talk show in Spanish. Wanted to ask, because there's a lot of confusion as far as when, not with adults, but mostly kids, when they test positive, do they need to keep testing until they come out negative? Or do we just go by 5, 7, or 10 days and assume that they're negative?
Who do you want to answer that question?
Any
Probably
of
Dr.
you.
Soni. It's the
I think Dr. Soni is probably the right.
answer that one.
Yes.
All right, so I'll start by saying thank you so much for the question. For children, it's no different than adults in the sense that if you do we generally do not push for this test to negative sort of category. And so generally we will see resolution of symptoms and that kind of a thing by day 10 actually. And if the testing strategy, if it is obtained, it's important to note that just like with adults, if it is a PCR-based test, in children too, it will remain positive. And so that doesn't really tell us much about actively replicating transmissible virus. So it's not very helpful to test these children at the 5 to 7 day point, no.
Does anybody else want to respond?
Yeah, so I think a little bit of basic science is in order. You know, the COVID virus is like any other virus. Most people develop symptoms somewhere between 5 to 7 days after being exposed to the virus. And then the actual disease lasts anywhere between 7 to 10 days. Most folks, and I want to reiterate what Dr. Soni said, children's immune system do not seem to respond differently to the infection as far as creating antibodies the same way that adults do. We have the same immune system. So by the time a child gets tested, if he has any symptoms, you know that incubation period is over and they're having that infectious portion of the disease, and anywhere between 7 to 10 days, it resolves. The issue with the testing is, and this is an analogy that I use with parents, is think of putting together a virus in the cells like building a car. You know, a car is not put together all at once. You know, you have the fender, you have the windshield, you have the tires, and then somebody starts putting it together. That's the way that the virus is created. So when you do a test, the test might pick up 1 or 2 pieces of the virus which are present, but the car is not entirely there to infect you. It's only pieces of the virus that are there. And that's what makes it so difficult for folks to try to test 5 or 7 days after the first positive test, because the pieces of the virus are still there, but the entire car is not put together because the infection is waning. And so the recommendations, and I found those to be very accurate, is you test on day 1, you retest on day 5. Some people are going to be negative, some people are not. And then after the 10 days, the possibility of you being infected is very minimal, so you don't really have to test. I know that other folks have advocated for testing at the 10 days, and it might be a psychological feel, just to have that negative test. But that's kind of like what we know in terms of the natural course of any viral infection.
Thank you. Ritu Jha, I'm sorry, Dr. Newaskar, did you want to respond as well?
No, Dr. Soni and Dr. Perez have done fantastic job in responding, so I'll pass, yeah.
Okay, the next question comes from Ritu Jha of Indica News. Ritu, could you please ask your question?
Yeah, hi everybody. It was really nice to hear about COVID among kids, and we have come a long way now. And I'm waiting no more Omicron or Delta going forward. So my question is, does Omicron affect children differently? Because you all have observed more than what we understand that other COVID, variant like Delta, which was earlier. So which were like, what are the symptoms you saw?
Dr. Newaskar, would you like to start?
So I guess the symptoms that the kids are presenting with are very similar to the previous variants, as I had mentioned initially about, the usual cough, runny nose, sore throat kind of symptoms. Those are the more common symptoms that kids are presenting with. And as I mentioned, that most kids will just have a regular cold. It will be just like a regular upper respiratory infection. However, there are few kids who are ending up needing higher level of care or having more complicated course, and those are the ones that typically we are seeing are the ones who have underlying medical conditions.
Yeah, because you mentioned that there were a few fatal cases, like a few patients. What you saw, like what was the reason behind it? It was not on timely. Treated on a timely manner, or the medication or vaccine?
Yeah, so I would say that the fatality or the cases of death that I was talking about were more in not necessarily in the current Omicron surge that I was talking about, but patients who have passed away with COVID-19 have been either like very, very sick with the pneumonia or respiratory failure itself. And typically, those have been cases where they have like really severe underlying immune problems, like either they have, I'm just giving example, like if they are on cancer chemotherapy and their immune system is like not able to fight the virus or generate. So those are the cases where there have been definitely we have seen them succumb to the disease.
Dr. Newaskar, I have a question. In adult medicine, we know that certain conditions makes it more likely for somebody to have a poor outcome. Diabetic patients, for example, obese patients, asthmatic, COPDers. Have you seen in your pediatric patients any particular profile that makes it more likely that a child will get sicker from the virus?
Yeah, excellent question. So similar kind of comorbid conditions as we see in adults are also risk factors in children. So children who are obese, children who have, coexistent diabetes, which is especially uncontrolled diabetes, those are really high risk. But then we have also seen children with severe lung disease, who have any kind of neurological impairment, kids with cancer, and sickle cell disease, and there are many other like severe diagnoses where we are seeing that they are more likely to have severe course, and they end up needing more involved care.
Thank you.
Thank you, Dr. Newaskar. Dr. Soni.
Sorry, real quick, before we move on, I wanted to piggyback on what Dr. Newaskar was saying with Omicron in kids, like she said, most cases are mild, limited to upper respiratory symptoms, sore throat. We've seen a lot of with Omicron in kids in this cycle. But in addition, we're interestingly seeing a lot of kids come in with something called croup. And I don't know if you've seen that as well, where they're having stridor and upper respiratory inflammation, which we see with other types of respiratory viruses. So that was something kind of different with this variant that we've seen in kids. But overall, it doesn't seem to be causing more severe disease overall.
Yeah, thank you, Dr. Soni, for pointing that out. And yes, we have seen kids with croup, and it goes with the whole this thing that more upper respiratory symptoms, and croup involves the more upper respiratory tract, and so definitely that's something we are seeing.
Mhm.
John,
Can I ask a follow-up question?
Actually, we need to move on. I'm sorry. John Fox has a question for Dr. Soni. John, please ask your question. John, are you still there? John asks a question about dosing. Let me see if I can find his question. Okay, Dr. Soni, if it's a dosing issue, would you say that the trial was done with too high or too low of a dose for that age group?
Sure, great question. So before I answer specifically for this, I kind of remind everyone that the Pfizer dosing for kids 12 and up is 30 micrograms. And then for the 5 through 11, they did a third of the dose at 10 micrograms. And so for this group that's still pending, the 6-month to 4-year-old group, they actually went down to 3 micrograms. And so that dose might have been too low. It showed a good response for immune protection in the 6-month to 2-year-old group. However, the 2 to 4-year-olds did not mount as high of an immune response. And so it might have been too low for that particular group, which is why they're moving forward with this third dose for that age group. So more to come, but yeah, I do feel that it might have been a little too low. And of course, we run a very, the researchers have a challenge here of producing that immune response, yet limiting those side effects that we don't want to see in kids, and making sure the safety data is sound. So I think that was the issue maybe.
Thank you. Renee Barbie has a very good question. Renee, please do ask your question.
Thank you very much. I would like to know, my daughter is 39 and she refuses to get vaccinated. So my question is, does a KN95 mask really protect you and others when you're out in public from the virus?
That's a great question. Who would like to address that first? Dr. Perez.
Dr. Soni is the
I can start with that question. So thank you, Renee. I will start by saying that we now kind of understand that certain masks are better than others, and a KN95 is an excellent mask choice in terms of preventing transmission of this virus. We know that masks like cloth masks are a bit inferior, and from the studies that have been done with cloth masks, we know that they kind of, when you're using a cloth mask, sometimes humidifies the air a bit, and so it might decrease the inoculum that you're exposed to, which may in turn mean that you'll have less severe infection if you do contract COVID with a cloth mask. But we know now really that a KN95 or an N95 is the way to go if you can. And if you can't get your hands on those, a surgical mask is the second best option.
Dr. Newaskar or Dr. Perez, would you like to respond?
Ladies first, unless she doesn't.
I would say, Dr. Perez, I would like you to respond.
I saw, and the details escape me, but I just saw a study not long ago, maybe about a week ago, that showed a comparison between a cloth mask, a surgical mask, and a KN95. Maybe Dr. Soni saw the study, and he showed that if you're exposed within 6 feet, you get more than 50% chance of acquiring the virus if you're talking to someone who's got no mask and disinfected. If you're wearing a surgical mask, that drops to about 20% or so. And if you're using a KN95, it drops to less than 5%. And so I think that study, if I remember correctly, was well done. It was thousands of people. And I think it clearly demonstrates that a KN95 is really the way to go if you really want to maximize the possibility of you being infected.
So a lot of people have asked the same question about the mental health impact of COVID on kids who've been home for the last 22 months, driving themselves crazy and their parents crazy. And I wonder if each of you could talk about what you've seen on the ground with your patients. Are they anxious? Are they depressed? Dr. Perez, would you like to start out?
Yeah, our behavioral health department has gotten a boom over the last year and a half, and it is all across all age groups, parents, grandparents, children of all ages. This virus was very isolating, and we human beings are social animals. Cutting ourselves off from others, it really has played a tremendous amount of burden on the psychological well-being of all patients in our society as well. I know that a lot of my diabetics, for example, already are predisposed to be depressed because they have a chronic disease that they have to take medications for. Take away the fact that they can't come to the clinic because they're trying not to get infected, and you can see that isolation really playing mind tricks in their well-being. Children as well, a lot of the children were resorted to social media to keep the social contact, and that is also hasn't been that healthy either. Lots of more bullying, lots of more inappropriate behaviors from kids when they're at home alone, sending sexting and sending inappropriate messages, just trying to keep in touch. So yes, it is real. And that's why we need to get back to schools the sooner the better, even if that means a temporary increase in the number of cases.
David, I'd like to bring you into this question. I know that Idris is only 13 months old, but have you seen behavioral changes in him over the past 13 months? Well, I guess that's
right.
But
So I'll give you a good comparison. My sister had a child in the middle of COVID who's going to turn 2 years old next month. The fact that her daughter did not go to daycare, you can see the big difference between my child and hers. I mean, and they're both wonderful, but Idris has that social interaction. He hasn't been deprived of that, and that's because we've taken a big risk in taking him to daycare. My little niece, Charlie, she's a wonderful little girl, but she's awkward around, other people that she doesn't know. It takes a while for her to warm up to people. Idris, by comparison, he's just ready to jump into other people's hands, welcoming arms. And that, poses, you can see the contrast. It could just be their different personalities, but I think a lot of it does have to do with the way that they're being socialized. Charlie doesn't know any different. She doesn't know any other kids. Idris at least gets to go to a community with other children where we hope the parents have engaged in doing the right thing, getting vaccinated. My sister isn't taking that risk.
Thank you. We're coming towards the end of this briefing. And before we end today's briefing, I'd like to ask each of the speakers for a quick 30-second soundbite. What for each of you is the most important message you would like us to take away from your remarks at this briefing? Dr. Newaskar, can we start with you, please?
First of all, I would like to thank Ethnic Media Services to make me a part of this important discussion. My message essentially is that because I see the more sicker kids, I feel like my message is that, yes, this is mostly a regular cold, but yeah, children can still get sick with COVID-19. And right now we don't know the complications from getting sick with COVID-19, because we know that there are some long haul symptoms that can happen to some people. Vaccines are very safe, and we now have millions of children who are vaccinated that show that side effects from vaccines are far less than the risk of having the disease itself. And lastly, we are in this together. I'm a parent of 2 school-age children and have gotten them vaccinated. And I really urge every parent and every child should be vaccinated of all the eligible age, of course. And I want to also add that for pregnant women also, right? Pregnant women should get vaccinated, as there are new studies and data that shows that it can protect the babies who are born to pregnant women who are fully vaccinated up to 6 months after they are born. And lastly, I'm eagerly waiting for vaccines to be approved for our really young ones, and would be looking at safety and efficacy data very closely for those. And thank you again.
Thank you, Dr. Newaskar. Dr. Soni.
Sure. Thank you all so much for having us. I'd like to start by relaying, I think this is something we haven't really touched on in so many topics we've covered in the last hour or so. But, when we look at the data now for COVID-19 and the deaths that we see in pediatrics, this has far surpassed prior influenza seasons. And over the last 2 years, we've seen over 2,000 deaths and counting in this age group from birth till 18, So this is no longer something that we can ignore in our kids, and it should be taken really, really seriously, though most kids do fine with it. We have seen quite a lot of deaths in these kids, and COVID should be thought of now as a vaccine preventable illness, right? So we should shift our thinking on this, and parents that are hesitant should really have those hard conversations with their providers. COVID-19 in kids has moved up to one of the top 10 causes of death. It's right under some of the other reasons why children pass away. And in my opinion, no child should die of this virus, really. So we should do everything we can to protect them when the time comes, especially for the young ones that are still waiting. There's so much flux of information and so many changing guidelines and restrictions and mandates and things like that. But we have to understand that we're in a marathon and it's not a sprint. And we've got to be fluid with the flux of information and science as we move forward.
Thank you, Dr. Soni. Dr. Perez.
Yeah, I want to reiterate what Dr. Soni said. The anti-vax voices cannot be louder than the voices of those of us who believe in the science and believe what our own eyes are telling us, that vaccines prevent diseases, prevents mortality. We know that. We've known that since the 1940s and 50s with the polio vaccine and all the vaccines that have come after. So anti-vax voices cannot be louder than ours. And we have to continue to hammer in the media in any way that we can. The vaccines prevent children's death and prevent adult death. And if I may spend 5 seconds on my soapbox, I would really encourage everyone, doctors and elected officials, private citizen, we must address the obesity epidemic in this country. We know that obesity is a major factor for diabetes, a major factor for heart disease, and a major factor for a poor outcome if you get COVID disease. So let's talk to our elected officials. Let's make good choices in our own homes with good food for our children and for ourselves. And let's see if we can slim down America for a little bit.
Thank you. Thank you so much. Sandy, final remarks?
You're mute, Sandy.
Did we get a last word, Sunita, from David Roman?
I am so sorry, David.
And David, I'm passing the last word on to you. Okay.
Well, thank you.
After the hour, and you've been very enlightening.
I'm going to piggyback on what Dr. Perez just said about the marketplace of ideas. As parents, as people in this society, we need, those of us who believe in vaccination, who believe in the science, need to have these conversations. We need to have these conversations in the community. We need to have the parent conversations with other parents, with our neighbors, because as Dr. Perez said, we cannot allow the minority of people who don't believe in vaccines, especially the COVID-19 vaccine, to have the day. We cannot relinquish what we know is effective science and just good common sense. And so therefore, it is incumbent upon all of us as parents to have those conversations with teachers, with our children, with anybody in our community, so that we're encouraging and creating the necessary conditions for people to feel more comfortable with the vaccine. We're all scared. We all don't know what the long-term effects of COVID-19 or the vaccines are, or if there are any. None of us know that. But what we do know is that the vaccines are effective right now. And that's what really should carry the day.
David, terrific final words. Thank you so much. And thank you to all our speakers and reporters who joined us today. We will see you on Friday. Bye.
Bye-bye.